Hello, I would like to thank the event organizers in inviting me to talk about updates in at-home monitoring of vision health. Here are my financial disclosures. As we know, glaucoma and other chronic eye conditions are increasing rapidly due to aging population. These diseases require lifelong monitoring of their eye condition. Clinic-based monitoring is resource-intensive, and there are direct and indirect costs to the patient and health system. If visual field and vision testing can be performed at home, then it could help hospitals and clinics triage patients into those who are stable and require less inpatient visits, and detect those who are progressing and provide more timely and effective treatment. There are now many devices available for portable vision testing with potential use at home. There are several flat-screen devices such as the Melbourne Rapid Field, which I will elaborate further, and EyeCatcher in the UK. In terms of goggle type of home vision monitoring, there is 4C Home for AMD home monitoring, and there are also several companies that produce VR goggle type of visual field testing. In addition, there are systems aimed to use objective methods of assessing visual function, such as using pupillometry or electroencephalogram. The MRF is a portable online web-based system that turns commercially available tablets, laptops, and desktop devices into thresholding perimeters. Compared to conventional perimeters, MRF makes visual field testing portable and suitable to telemedicine. The software has been extensively validated with over 10 peer-reviewed papers. The test can be performed by patients through computer voice guidance, which makes it easy for patients to monitor vision at home. The outputs of the MRF has good concordance with a gold standard perimeter with familiar test outputs with 10-2, 24-2, and 30-2 protocols, taking approximately 3.5 minutes per eye. In a recently published 12-month at-home monitoring study for glaucoma patients, we found patients were able to reliably perform visual field testing at home with high correlation of home visual field outcomes with HFA performed in clinic. By allowing higher number of testing, we found that home-based field monitoring reduces the mean absolute error in estimating visual field progression beyond what is possible with Humphrey visual field tests performed in clinic. We have also shown that tablet-based vision monitoring at home can be used to monitor macular field changes in AMD. We have published a home monitoring study of AMD patients in American Journal of Ophthalmology, in which we showed that in some patients, reversible reduction in retinal sensitivity correlates to choroidal neovascular activity. We have also published a clinical study of bedside MRF use in stroke patients in hospital, showing many stroke patients have previously undetected visual field problems. In conclusion, we now have portable technologies that make home monitoring of vision health possible. Patients are able to perform the tests reliably at home. The relative low cost of these technologies means that there is good potential for widespread adoption. The increased frequency of testing could lead to earlier detection of disease and potential for earlier treatment. Further questions in this field include whether home monitoring can be useful in large-scale detection of glaucoma and retinal disease progression, and integration of AI in progression analysis. Also, further research is required into how we can integrate these technologies into current clinical practice to improve patient care. Thank you for your attention, and I would like to acknowledge my colleagues, Mr. Selwyn Pri and Professor Algie Vingras, as well as my funding bodies. Thank you.